Good afternoon and welcome to this webinar organized by Cities for Women program at Cities Alliance. In the light of the current COVID crisis, today we would like to reflect on the impact of the lockdown measures and health emergency on women's lives in cities, looking at gender inequalities built in our neighborhood, in our cities, that this crisis is revealing. We would like also to identify together with our speaker what are the priorities and the elements that a feminist city, so a city that is more responsive to women's need and potential, should have. So I'm happy to welcome Leslie Kern, which is a feminist urban geographer and director of Women's and Gender Studies in the Department of Geography and Environment at Mount Allison University. Leslie is also the author of the book, The Feminist Cities, that gives the title to this webinar. So, hello, Leslie, can you hear me? How are you?
Hello, it's Leslie here.
Sorry.
Hi, Leslie.
Hi.
Hi, sorry, there was a colleague of mine that was looking at the technical issues and we had a technical problem. So sorry, welcome, hi.
Hi, thanks so much. I heard you introduce me already,
Yes.
So thank you so much.
How are you?
I'm good.
So thank you very much for being here with us. I think this topic, I read the book, The Feminist City, I think is really important for this period to reflect on what the feminist cities should be and what is the impact also of the COVID crisis on women in cities. So you are a feminist geographer, so you are used to look at spaces, geographies, and urban fabric from a feminist perspective. And what do you see now? Is there a specific impact of the COVID-19 on women's urban life that you can recognize?
Yeah, that's such a great question. There's so many impacts. I know, it's common in feminist studies of women's lives to talk about things like the double day, right? Or the double shift where women work their paid job and then they have all of their unpaid responsibilities. But I think what we've been seeing right now is like a triple shift or a quadruple shift being downloaded to women, as so many of the social services that are considered at the moment non-essential or less essential have been fully sort of privatized into the home. And in terms of, urban life, that's one of the things that people rely on in cities, or why we live in cities, so that we have all of these services available to us, both government services and, commercial services. Mm-hmm. And when we don't, we are all of a sudden left with taking on all of that labor, both physical labor, time, and emotional labor ourselves.
Yeah, of course, but and in terms of also, we have seen that, for instance, domestic violence is increasing with the lockdown. What do you think about that?
Yeah, it's very disturbing. We're hearing a lot about that as well here in Canada, and there's been some effort from our government here to increase funding to women's shelters right now so that they can continue to run whatever programs they can. From a feminist geographer perspective and urban perspective, I think it's an interesting moment because we are maybe starting to realize that domestic violence, this so-called sort of private phenomenon of the home, is actually very much connected to everything else that's going on in society. And that work to end or even investigate or identify domestic violence also happens in the public sphere. And when we don't have our contact with our workplaces, our friends, our family, our communities, then that influences what is happening in the private sphere in terms of domestic violence. And I would hope that one thing that might come out of this afterwards is an ongoing recognition that, the public sphere very much has a role to play in ending what has for too long been thought of as a private phenomenon.
Yeah, I think it's the COVID-19 crisis is also changing how we perceive public space and our relations with cities, with others, and also our perception of safety, exactly. And these are all, I think, critical aspects of women's relationship with cities. So public spaces and safety, exactly. How do you describe this relationship historically and today? So the relationship between women and public space, exactly.
Yeah, so we know historically, in most Western cities, there's a really long history of very explicit exclusions of women in public space, and women being, forbidden from accessing certain kinds of public spaces, or having severe limitations on what they can do, how they can dress, whether they need a chaperone, what times they can be out. And of course, over the late 19th and throughout the 20th centuries, we've seen a changing in that, particularly as more women from different social classes entered the workforce and began taking on more roles, more public roles in everything from politics, education, arts and culture, and the business world as well. And in many ways, cities adapted to this in terms of creating spaces that were sort of feminized, right? That were more
commercial spaces, no, mostly. So they were
commercial spaces. So things like the department store,
yes,
exactly,
right? Exactly.
And cultural spaces, and even sort of cafe culture being more welcoming than like the working man's pub sort of spaces.
Mm-hmm. Mm-hmm.
But there's still questions about, which women can sort of enjoy these freedoms that we have to pay attention to. And we know that there's still restrictions placed on women, for example, women who wear a face covering. Now, not a surgical mask, that's okay right now. But if you wear a face covering due to religion, then in many places you might be policed for that, or it might be forbidden altogether. Sex workers are still very much sort of curtailed in where and when they can practice their profession. Trans women are still sort of policed in terms of how their gender identity is portrayed, and queer women as well. So having access to public space and being able to be who you are in public space is still something that we can't entirely take for granted for women.
Now, of course, and also I think the aspect of what you say as a public woman, it's normally is considered not a sex worker. So the aspect of public and woman together has been always connoted as a kind of negative aspect, a negative connotation.
Yes, and I think we see today in our kind of digital age, when women have a very visible online presence, lots of Twitter followers or a strong social media presence, the way that they are really viciously attacked on social media. And it's just sort of like, well, what do you expect? You're in public, you're a public figure. And I think that harkens back to that history of like, well, if you are going to be out in public, then, this is what you have to expect. You should expect harassment. That's just normal. You should expect even a certain amount of potential violence and fear to accompany you. And now we're seeing that kind of translated into the digital realm as well.
This kind of also idea. So on one end, I think there is, of course, there is an increasing number of violence in public spaces. So I think like 60% of women have reported feeling unsafe in urban space. So there is also something really tangible related to the urban fabric and the space, but there is also a perception created by media, I guess, to in a way, limit the freedom of women in space. What do you think?
Yes, absolutely. We're socialized from a very young age to be very careful of how we use public space, how we dress, where we go, what time, whether we call a friend, whether we go alone. And to a large extent, that is reinforced by actual experiences of violence or even just harassment that sort of reminds women like, oh, this isn't safe for you, or you don't really belong here. And that sort of builds up this long-lasting fear that many women express, that they don't feel entirely safe in urban environments, even in cities where the rates of violence, public violence, are relatively low, like in Canadian cities or European cities.
Yep, and I think also this issue of safety has also generated like a multiple safety index city ranking, cities that are also competing in becoming safer. But of course, the impression is also that safe for whom? So sometimes the impression is that it's just cities are also showing that they're safe to attract investment, but in reality, they're also excluding other people, other marginalized groups. So the aspect of safety is a very controversial, I think.
I agree. That's something that I tried to write about or to be careful of in my book, because often if we focus on just sort of this generalized idea of women's safety, the kinds of solutions that cities come up with end up being things like more policing, more surveillance, more CCTV, more invasions of privacy, more private security, more kind of top-down control of public space. And you don't have to look very far to see kind of who gets impacted by that the most. So we already mentioned sex workers, but of course, homeless people, people of color, recent immigrants, poor people, queer people. These are the people who feel that impact firsthand. And we end up with this idea of a sort of clean and safe city because maybe we don't see homeless people, but they've been pushed to the outskirts of the city, sometimes quite literally picked up by the police and driven to the outskirts of the city, so that we just don't see that problem. And I always want to be really careful that when we talk about women's safety, we don't immediately turn to these sorts of quote unquote solutions that make urban life much more dangerous for many groups of people, including groups of women as well.
Yeah, of course, there is also criminalization of stigmatization of certain groups and certain neighborhoods in relation to that.
Yes, absolutely.
And you mentioned technology and digital spaces, and I think it's quite interesting, this aspect, especially today with the coronavirus pandemic. No? So we are forced to social isolation. The internet is becoming our public square. No? We are still figuring out how to use the space, but of course enables us to meet, enables children to attend schools, lessons, and have access to primary care. But we know that women have less access to technology and internet compared to men. Do you think the gender digital divide can be somehow, with this crisis, can be filled, or are you optimistic with that?
Well, it's really interesting that I think this pandemic is really testing the limits of how connected we are, in terms of reminding us that actually there are a lot of global inequalities in terms of connections. You know, I live in Canada, I live in a rural province, and when this sort of moved to, okay, kids aren't in school anymore, we'll go online. Well, there's not a lot of high-speed internet in many communities where I live. So something like sharing a video or a Zoom meeting is impossible for many families. So there's that kind of class and spatial divide in terms of that connectivity. And I think we're also seeing a bit of a reminder now with all of this sort of, okay, if you download this app on your phone, then Apple can sort of report whether you're practicing social distancing or not. So questions about privacy and surveillance, and those are very gendered questions too, because we know with the rise of smartphones that it has a relationship to domestic violence, intimate partner violence, as women's movements can be tracked via their smartphones, and that abusive partners will often try to control women's access to technology. And this is a real concern right now for women who might want to call or text a women's shelter. Being in close proximity to your abuser might mean that you can't use that technology in that way. So I think that this particular moment, as you say, is going to force us to ask some of these hard questions and to recognize where some of these inequalities and where some of these problematic uses of technology might be taking us.
But at the same time, as you mentioned, for example, the Me Too movement or Cuéntalo, in Latin America, they were such a powerful mobilization, and they were basically counter public space to challenge rape culture exactly in ways that the normative public sphere and public space has denied. So there is also a possibility offered by social media on that. To be connected and to raise a voice and to have also political impact. What do you think about it?
Absolutely. I think the conversation, particularly around Me Too, sexual harassment, you know, that conversation has now changed, and hopefully permanently, that we can no longer talk about sexual harassment in the workplace, in public spaces, in educational institutions, in sports, and so on, without a recognition that this isn't, you know, an individual problem or a problem with the culture of that organization or that industry, but that it is a global problem. And, you know, the sort of accompaniment to Me Too, like hashtag yes all women, right, that everybody can relate to these experiences in some way, means that we can no longer kind of deny or downplay what the impact of harassment and sexual violence is. And absolutely the role of social media in making sure that that conversation did not sort of, oh, this is one bad person or a couple of bad people, that we realize it's a global problem.
Yeah, but of course, in many places of the world, women don't even have access to internet or social media. So there is also a problem really of infrastructure and capacity as well, and also digital literacy. So probably the priority should be to extend and to bridge this gap.
Of course, and in many places, women have, well, lots of people have government censorship of what they can post on the internet as well. And that is obviously going to impact whether any given person can speak out about a particular injustice or something that they're worried about. So again, sometimes maybe in the West, we imagine the internet as this, you know, opening up realm of democracy without kind of reflecting on how uneven that is globally.
Speaking also about like safety, we mentioned briefly before about domestic violence during this period. And for me, it was very interesting when in your book, when you talk about the fact that there is a lot of attention and a lot of actions around safety in public space, also in relation to gentrification that we mentioned. But in reality, women are more victim of domestic violence than public violence. So there is completely kind of a paradox in that. Can you explain better and this paradox between safety in public space and domestic safety?
Sure. So it seems like a paradox because women are much more likely over their lives to experience violence from somebody who is known to them, right? So often an intimate partner, but it could be a family member, somebody in the workplace, a friend, an acquaintance, much more likely to experience that than to experience a kind of an incident of stranger violence in public. And interestingly, men are more likely to experience stranger violence, right? Not necessarily sexual violence, but stranger violence in terms of encounters in public space. But women report much more fear of public space than they do report fear of the home. Now, sometimes they're not asked about whether they feel fear in the home in terms of like fear of crime surveys. They tend to focus on the public space, so that kind of skews the data. But it's been seen as this sort of paradox, like, why do we have fear in public space when that's, you know, technically we're less likely to feel fear there. But when we take into account, as we talked about before, all of the socialization that goes into telling women about how fearful the public realm should be for them, that then we start to see it's not really a paradox. And of course, women do experience harassment in public space. And when there is violence against women in the public sphere from strangers, those stories tend to be very sensationalized, highly reported in the media. We hear a lot about them. And we don't hear that many everyday stories of domestic violence reported in the media, because then that would be all that we would hear about because it's so common. So how do we resolve this paradox? Well, the solution is not necessarily to not take any precautions in public space, but partly we have to really challenge the idea that the kind of heterosexual family unit is the place where women should feel safe and protected. I mean, maybe they should, but in reality, it's not that easy. So we have to really be careful about our kind when we talk about women's safety, that we can't think about it purely as a public realm issue.
Also deconstruct this kind of roles and understand really the dynamics. So as you said before, to connect the safety in public space with safety in domestic places, because they are interconnected. It's about culture. It's not only about physical elements. It's about culture. It's about economic space. So the economic independence. So it's a very interconnected and complex topic.
For sure. And one thing that we see a lot that, you know, connects back to the urban realm in many cities, you mentioned briefly gentrification, is this sort of crisis of affordability of housing.
Yeah.
And with women already making, you know, lower wages on average than men, being more responsible for children post-divorce or breakup, that many women can't afford to leave bad relationships or abusive relationships because they have nowhere else to go. They can't afford housing on their own. There's very little in the way of kind of transitional housing, you know, between a domestic violence shelter and independence. And that sort of crisis of affordability, this rise of gentrification, the lack of accessible housing is also connected back.
Connected with, of course, women's empowerment and independence. Yes.
Yeah.
Of course, and I think you mentioned this the role of women as a caretaker. No, so we know that the majority of the care work, unpaid care work, is provided and carried by women, and nobody is really even estimating the value of this unpaid work. There are some estimation that says even that is around the 9% of the global GDP, but we don't have data about what does it mean. And I think now with the COVID situation, with schools closed and children at home, we have isolated sick and elderly people, housework to do. We are kind of realizing the importance of care work. We are feeling it, and that without care work, our society wouldn't function. What is your perception about this problem, which is a very complex problem, because of course, if the women are responsible for 75-80% of the unpaid care domestic work, they don't have time to do other things, to go to school, to work, and to be again independent.
Yes, and I think it's interesting that, again, this crisis is kind of ripping the veil or the cover off of so much of the largely invisible and, of course, very undervalued fabric of care work that really, like, literally keeps the world functioning, right? And we sort of sometimes think, oh, care work, or that's looking after kids or cleaning in the home. And yes, that takes a lot of time, as most of us know, but there's also all of that kind of more intangible and even more invisible work of just like connecting in the community, right? Of taking care of neighbors, of calling friends, of looking after elderly parents, of you know, keeping the social fabric of the world kind of ticking along. And so much of that, you know, some people call that emotional labor or mental labor. And so much of that falls to women. And it's even kind of harder to calculate than, again, sort of hours spent on childcare or house cleaning. But we're really seeing now, like, oh, when you strip all of that away, like, we're left with very little, and we're left with very just sort of the economy kind of struggling along because it relies so heavily on somebody being able to do that work. And so if I was feeling very optimistic and hopeful, I would say that, well, you know, as we move through and beyond this crisis into kind of a new world, we will value all of this care work, both the unpaid care work and the paid labor of nurses and cleaners and teachers and grocery store workers, and they will all make, you know, much more than minimum wage, and they'll be considered essential workers and all of these good things. But if I'm not feeling so optimistic, I fear that we'll kind of go just, that it may even be regressive, that we'll just rely even more on women to pick up all of the slack that the public world can't take on right now.
And I think there is also division between women that are working now and they can afford, they cannot afford in terms of time to take care of children and domestic work, and then they rely on other women. So there is also this kind of division also between among women, also like a class division.
Yes, this kind of a sort of a global division of labor, even where we rely on nannies, domestic workers, and so on, who often come from other places around the world. And you know, the movement of that is going to be highly restricted. And of course, those women are at a great deal of risk in terms of, you know, their spatial arrangements within a family and so on. And even in, you know, we just think it seems a little bit trivial, but we think of all the kind of feminized jobs that we rely on to kind of keep us going, everything from like your hairdresser and the people who kind of look after your body in various ways, and we don't have access to that anymore. And again, it's not a life or death issue, but it's just a reminder of kind of how many sorts of layers of reliance and interdependence we have built in to the system, and its ripple effects are very far reaching.
And also there are some parts of the world where, due to the lack of adequate health services and water and cooking facilities, women are also, for example, forced to make multiple trips a day to collect water or to get the medical care for their family. So they're spending even more time on this kind of duty, and this reduces even more their opportunities and to do other things. So there is even a subdivision, and even women and girls that are living in poverty, that even they experience the greatest time poverty at the end. So there is also an issue of how to reduce difficult and efficient tasks, for example, collecting water and prioritizing basic infrastructure provision in informal and poor urban settlements or remote areas.
Yes, and you know, it's not like those issues are suddenly new, right? We've known about them for so long, but we haven't really done anything about them because it's just women and girls doing this work. It's not a priority, and you know, there's an opportunity now to realize that, you know, that work that they're doing is, again, like essential labor that literally keeps people alive, and that they are putting their lives at risk, or more risk in many cases, to go out and do that work of collecting water, preparing food, looking after people, and so on. There's some hope that maybe, oh, okay, we realize like if we can improve their access to those basic necessities, then you're improving society for everybody. You're improving our overall health and well-being in a much wider sense.
You mentioned in your book the concept of careful cities, careful urban future, and really building on this concept and this realization that women have coped with these issues of unpaid care work by sharing the responsibility of taking care of the child and so on. Can you elaborate? I think it's very interesting. And when we think about the cities that we want after also this crisis and COVID crisis, I think this concept could also be kind of result of this moment.
Yes, for sure. I think the crisis is pushing us to look critically at some of the spatial arrangements of cities that relate to care work. So everything from kind of how our healthcare system is spatially organized, right? Do we have large centralized hospitals or a dispersed kind of community health system? Where are our schools? Where is childcare? How does public transportation get low-paid workers from the outskirts of the city into their now essential work in grocery stores and healthcare and sanitation? And recognizing that very much kind of how the city is set up, our housing arrangements, and relates to how we as a society can actually be resilient in the face of something like this. And in a long-term sense, if we can, you know, incorporate a gender analysis into our rethinking of those spatial arrangements as we move forward, you know, that might be a moment to make some improvements or to make some changes to this kind of burden that women have shouldered for so long.
Yeah, yes, of course. But I think this is also related to this kind of soft community approach to urban development versus a kind of hard infrastructure approach, planning infrastructural approach. So try to also involve the community understanding the practice also already in place, taking place, and try to incorporate in a kind of new urban vision. So understanding what is already going on, what are the dynamics.
Yes, absolutely. So planning does tend to be a kind of top-down process. Some places are more consultative than others, but in many ways it's a sort of, we want to create a master vision, a grand plan, and this is how things are going to work, and this is going to be the most efficient, and so on. And we don't often take into account things like care labor or the, you know, daily transportation journeys of women who are mothers and shift workers or things like that. But at this particular moment, we're sort of seeing like, oh, that really matters. It really matters to everybody. It really matters to our survival as a society. And as you say, paying attention to what's going on at that day-to-day level, that community level, the very local level is very necessary to figuring out, like, again, how this system, how our society can sustain itself through a crisis.
And what do you think about the gender mainstreaming in cities? Because like city like Vienna is a very famous example that really incorporate gender into every policy and every planning instrument. And other cities are trying to do the same. Also in Albania, Elbasan, some city in Latin America, they are trying to incorporate gender mainstreaming as an approach. But there are also limitations to that, exactly when we talk about the involvement of community, the bottom-up approach. What do you think about gender mainstreaming in cities, in city development?
So it's an approach that really shouldn't be radical, but it's still in many places it's seen as very radical. Like in Canada, we had this, you know, they talked about considering a gender analysis of the snowplow budget and schedule in cities like Ottawa, and people are like, what? That's ridiculous. No, that's not a gender issue. Those crazy feminists. But recognizing that, you know, the order that you plow roads in or sidewalks has an impact on like who can go to work and when, and whether children can go to school and those sorts of things. But it's still sometimes viewed as like too radical and too weird a thing to incorporate. On the other hand, one of the potential criticisms of gender mainstreaming, even in cities that have done it very well, is that there might be a tendency to reinforce the idea that women are responsible for all of this care work. Like we're just kind of figuring out ways to make women's care work less troublesome rather than figuring out how to fully redistribute care work so that it doesn't fall as much on women. So I think that's something that we have to kind of balance when we have a gender mainstreaming approach, is that we don't sort of fall back into traditional notions of what gender roles look like.
And also I think you rely a lot on the role of city and the public, and sometimes really the innovation and the new initiatives, then also how to challenge the kind of traditional family or relationship between men and women is coming more from community practice rather than the city or the government.
Yeah, exactly. I mean, we're not really, I think in most places, it's not going to be the government that leads us away from a traditional heteropatriarchal model of the family and housing. Those things are going to come from people pushing back against those constraints and saying, I don't want to live my life like that, or I want my household to incorporate my friends and my grandmother and my sister rather than a husband and children or something, right? And figuring out like, how can we make that work in our cities? How can that jive with our like property ownership regimes or our zoning laws? All of those kinds of questions. And you're right, it's coming from the ground up. It's not going to be somebody in government saying, hey, let's abolish the nuclear family.
Yeah, So the questions are coming from the society. And do you have in mind some interesting practice from at the community level, but also the city level, that really push ahead the aspect of feminist city, or in any case, a city that is more responsive to women's idea and needs?
Yeah, it's interesting. I mean, I think there was a moment, speaking from a North American context, where there was, you know, in the 80s, for example, there was some, you know, good funding for public housing that could include women's housing co-ops, or housing specifically for single women or disabled women or queer women. And with the kind of shift to a more neoliberal funding model in cities and so on, a lot of that ability to kind of create new forms of housing with some government money has really trickled away. So there's definitely a serious challenge in terms of finding ways to do things differently, because in a lot of cases, just the money and the wider based support isn't there. So I think what we're seeing are very local, small scale initiatives coming from nonprofit organizations, like organizations, for example, that work with sex workers who, you know, at least in the Canadian context, have had some success even challenging our, you know, national laws on sex work. Things are not sort of perfect in that regard here, but it's again coming from that local level of people pushing back on systems that have made their lives less safe and less livable overall.
There is a question that I read from the chat, talking about patriarchy, and I think it's really relevant. So what needs to be done to deconstruct it, especially at the city level? Can we do, what are the action that we can prioritize to fight against patriarchy?
Yes, that's
a big question. It's a big
that's
question.
definitely the million-dollar question.
Yes,
Well, one of the things that, you know, that I was aiming to do with the book that I wrote was to make that elephant kind of visible in an urban context. So we tend to think about the built environment as being kind of neutral, right? Like it's it isn't patriarchy, it's not sexism, it's not racism, it's just buildings, and social relations just happen in them, and inequalities just play out in them. But part of what I wanted to do with the book, and what feminist geographers have been trying to do for a long time, is to say, no, actually our social relations are kind of built in to our environments, both urban and otherwise. And if we can start to notice, at the very least, how that's playing out, then we have some opportunity to shift it, right? To do things a little bit differently. Now, it's always a challenge. The built environment lasts for a long time, right? You're trying to create a new world out of an infrastructure. I mean, thinking about Europe, right? You could be talking about hundreds of years of buildings and neighborhoods, right? And you don't just change that overnight. But when we can start to notice how people's lives are differently affected by the spaces that we move through, how our cities are set up to make some people's lives relatively smooth, seamless, conflictless, then things can start to change. So historically, we've sort of imagined as sort of the male commuter, the male breadwinner, the male worker as the subject of the city that we need to facilitate his ability to get to and from work, for example. And we've set so many things up on freeway systems, our public transportation, where our offices are, where industry is. And what if we just started from a different place, right? What if we started from the needs of people experiencing homelessness, people with disabilities, women with children, single parents? If we started from a different place, we might be able to envision things differently. And we don't have to tear everything down to do that, although that's tempting sometimes, but we can start in our own neighborhoods, perhaps.
Yeah, so using basically also the space and cities to show this kind of inequalities. So looking at public spaces, you can see who is excluded. And all the cities is basically built around, yes, a white man. So understanding what is the space for the others. where there's space for the other. And I think it's quite interesting, the example of public toilet, which seems completely relevant and is quite, it's so evident there, no? That bathrooms and public toilets are not designed, are not equipped for women, for women's needs.
No, and you know, historically, cities didn't even want to provide toilets for women because it was just seen as like improper, first for women to be really out in public, and then for them to, God forbid, lift their skirts even in an enclosed washroom, right, outside of their own home. So yes, and today what we've seen in many places, particularly in North America, is that cities have all but given up on actually providing public toilets at all, and we just rely on, you know, Starbucks, right, to supply your public toilet. But of course, as we know, you probably need to buy something, and if you're not white or you're not middle class, then you may be excluded or face you know, a call to the police simply from being in that space. So public toilets really are kind of a window into ways in which we exclude people. And of course, people with disabilities have, you know, long battled this as well. And we can often look to physical accessibility as a kind of, again, a sort of a litmus test of how open and welcoming a city is.
And also, of course, there are not enough public toilets in our cities around the world. So in New Delhi, there is a big movement to claim more toilets, especially for women, accessible for women. So the sanitation is a big issue because it's also related to rape and violence in public spaces, because women are forced to find isolated places, and also during the night, so they are more exposed to violence. But it's also interesting that even when the toilets are there, sometimes women are not using them because they are not clean enough, there is no privacy, there is no security. So the way we also design and think the toilets and like basic facilities, we are not thinking about everyone, we're just thinking about one portion of the population.
Yes, exactly. Anyone who's tried to use a public toilet with a small child with you, for example, or who's had to help take care of somebody with a disability or an elderly person in a public toilet, you know that these are, you know, it's not something that you want to have to do. And that means that for many people, you know, you're staying home, you're not in the public realm, right? And so that has this bigger knock-on effect when we think about what is the benefit of cities, right? It's the coming together of people from all different backgrounds in an ideal sense, right? The democratic city. And if there's some groups of people who are like literally not leaving their homes because they don't feel able to use a bathroom or to access public buildings, then how democratic is that, right? Who are we seeing in cities? Whose voices do we hear?
There are two questions from the audience. One says that when you said that private violence is experienced more than public violence for women, is that true across economic stratification and demographically?
That's a good question. I mean, I don't have a sort of a set of global data, but it does seem to be something that holds true now for some women. People who are sex workers, for example, that might not be the case for them, given the high rates of violence that some people experience in their work. So it might not be as easy to make that claim for some particular groups of women. And of course, in some parts of the world, public violence against women is more common than in other places. But I think in general, I'm sort of comfortable with that, in part because we also, we know that violence against women, both public and private, is highly underreported. So everything that we do know is only the tip of the iceberg, because we probably don't know about anything from like 70 to 80% of the cases of violence that just never are reported.
Exactly. So also public violence is not reported, so we don't have data about it.
Absolutely.
Reliable data. There is another question about, at the beginning you mentioned the double, triple and quadruple shift that women are now experiencing, practicing now with COVID-19. They're asking some examples. Virginia is asking some examples.
Sure. So, well, I mean, Julia, you mentioned at the beginning, sort of children being sort of homeschooled, or even if they're being schooled over the internet, there's still, especially for younger children, a lot of parental supervision that has to happen. So somebody, even if you are in the home, you know, if you're trying to work from home, you're trying to do your job, you're trying to be on a webinar or something, and your child is like, how do I do this math question? You're sort of multitasking constantly throughout the day, and you're probably thinking to yourself, like, when do we need to go to the store and what do we need? Because now that in and of itself is a much bigger deal. You can only go once a week and you have to get everything that you need. You can't, or you shouldn't just run out to get that one thing that you forgot, right? So you're anticipating the entire household's needs. And you're probably also thinking about, you know, your elderly parents who are in a care home and how you're going to contact them and what you're going to do if they get sick. And so it becomes all of these extra layers that, you know, previously your children would be at school or in daycare, but now it's suddenly fallen to you, and taking care of people who are sick, who, you know, you're not just going to go to the hospital or the doctor's office. You're going to be doing that in the home now for the most part.
Yes, there is another question related maybe to the conversation that we had about technology and public space. And the question is, I think is quite interesting. Do you think there is something that we can do using the internet as our public space to help women facing domestic abuse during the crisis, especially in the context of developing countries?
Yeah, I would like to think so. Now, again, the ability to access technology varies greatly geographically and by social class. So, but there are some relatively, you know, lower tech things that could be available, whether it's an SMS messaging service that women could access that, you know, is secure and is sort of not able to be tracked by partners. That could be something. People are also, you know, able to access, for example, counseling or services online again, but this issue of isolation in the home is definitely a problem because you don't kind of have the ability to be out of the same space as your abuser in many cases. But I think hopefully, you know, I know that all over the world, groups have been developing things like apps that can help people to report violence in ways that are safe and don't expose them to their abusers. And this might be a moment where we could see a boom in that.
If I can add, with Cities Alliance in the past, we support Safety Pin, which is an app in India that is basically helping women to report about safety issues in public spaces, and then the municipality can also intervene in public space. And currently in Tunisia, we are working on developing an app, a very simple one, also connecting with Facebook, that is very used in Tunisia, to help exactly women to report about domestic violence during this crisis and lockdown, and providing some basic service. So I think there is a space, but as you said, not everyone has access to that. So we have to differentiate using also, as you said, I think messages and just a simple number. Other question is related to public space. We already mentioned how the current crisis is showing the need of women in public spaces, and how can we use this as an opportunity to push for women reappropriating the public sphere?
I think, there's lots of opportunities here. One is recognizing and revaluing the kinds of paid work that is, you know, still dominated by women in many cases, and is sort of underpaid and undervalued. So that's everything from nursing and care home work and you know, personal care workers in healthcare industries to, you know, the service workers in grocery stores, often very young women as well, and older women who work in those kinds of service jobs. And we kind of see their labor as not that valuable overall, or as easily disposable and replaceable. And I think if we can shift away from seeing women's labor as kind of easily replaced and you know, not high skilled, as somehow, you know, they're biologically predisposed to caring, so, you know, we don't need to pay them a lot to look after children, this sort of thing. If we can shift that, then that has great knock-on effects, right? It could increase women's economic independence if they're able to make a living at the kinds of work that they do. It increases their ability to pay for education. It increases their ability to, you know, leave abusive situations if that is necessary, and so on.
There is, I think, in relation to public spaces, is also the fact that for the first time, everyone is experiencing fear in public space. You know, we are almost, we are suspicious about the others. We avoid contact. So somehow we are experiencing what women are experiencing every day in public space. So you are in completely at the center of attention. You need to avoid contact. So this is also a kind of, if we can catalyze also this kind of feelings, and could be also interesting to increase exactly safety, but also comfort of women in public space, freedom of women in public space.
Yeah, and raising that awareness that yes, this
exactly.
Many people experience all the time.
All the time, exactly.
Social distancing, or a distrust, or, you know, just a constant awareness of your body in space and who's around you, that now everybody is needing to pay attention to that. Although anecdotally, I've been seeing stories of people saying, well, you know, a lot of men in public are still not like particularly aware of how close they are to other people, and don't seem to be as willing to like cross the street or move to another space. So whereas for women, it may be coming a bit more naturally because we do that all the time anyways, not just out of fear, but because we're sort of socialized to, you know, make way for other people or to take up less space. So, you know, again, that's just anecdotal. I don't know if that's, you know.
Yes, I don't know. It's like more an advocacy, probably, action. There is, so in relation to this, there is another question. Looking forward, do you foresee a particular change in the urban experience of women resulting out of the COVID-19 crisis? Since we are also approaching the end of the webinar, I would say how we can imagine, I think it's also time to not just react to the crisis, but really imagine a new urban future, and can be also a feminist city. What are the key elements that you would use or you would identify for the feminist cities that you would like to project in our future after the COVID?
So many of these things we've touched on throughout the webinar. So bringing them together here, thinking about the redistribution of care work and the revaluing of care work, that has to be a huge priority. And then, you know, from a geography, from an urban perspective, how can we re-envision the spatial arrangements and the built environment in ways that don't leave us so vulnerable to relying on just one underprivileged group in society to do all of this work. Obviously, safety has been a big question, because we know that in many ways, you know, without that sort of basic foundation of safety and security of the person, these broader questions of economic independence and education and so on really can't be fully realized without that. So we have to really think about ways in which domestic violence is not so much a norm or an expected thing, but that how can it become incredibly rare? How can we set up cities in ways that make it fully possible for women to not have to tolerate abuse in any way? How can we think about different models of family, for example, right? Who do we rely on? Who are we interdependent with? And how can we find ways to strengthen those ties beyond the traditional sort of
Yes.
nuclear family, right? How can
Which is also, yeah, it's also connected with the idea of connecting women, no, and friendship among women.
Yes, and I think again with this crisis we're seeing, you know, for people who live alone, for elderly people, for people who are in care homes, and so on, that level of isolation, or people with disabilities who experience a level of isolation on a day-to-day basis, but we just really don't care, or we haven't cared in the past, but now we're seeing that that is part of this crisis. How can we think about cities that really enhance those networks so that nobody is kind of left behind when we do have moments of crisis, whether it's economic crisis, health crisis, environmental crisis, but that there aren't people who are left even more isolated and less cared for in society.
Yes, I think it's key, this connectivity and social network. I think it's really key. Now I think we are really closing the webinar. I would like really to thank you for this very interesting conversation and also inspiring insights. Thank you. I think we need also to think beyond this crisis and think about what we want and what we want to, which city do we want to build. So I think it was very, very good, very interesting, and thank you.
Thank you. Thank you for your wonderful questions, and thank you to participants for asking their great questions as well.
Thank really you all for this huge participation. This also demonstrates a big interest in this topic, and we will for sure organize more webinars, more sessions on the topic of city for women and feminist city. Thank you all. Bye.
Thank you. Bye-bye.
Bye. Bye.